To stay healthy for a patient with CF, I would say all the same things I would say to a child that doesn't have CF that are important. You need to have good nutrition. You need to take good care of yourself. You need to get good sleep. You need to keep your clinic appointments. You need to take your medications. You need to do your therapies. All of those things that we talk about with someone else.
Avoiding germs is very important for the patient with cystic fibrosis because when you are exposed to germs, you're putting your airways at risk for increased lung infections and inflammation.
Keeping the house germ-free. I might be a little bit of a freak about this.
Yes.
I keep Clorox wipes or the sanitizing wipes in every bathroom, any bedroom, every room, so that it's just easy to wipe down everything.
And we have hand sanitizer by the doors right when we come in because I work at a school, and so I become a freak at school, cleaning everything and have hand sanitizer by the door. And so when we come home from school, after I pick up the girls, first thing we do is we put hand sanitizer on, we wash our hands, we take off our shoes, we change clothes. We make sure we try to keep as much of the germs away from Jack, especially these first few years, because it is vital.
You know, our kids have gotten the flu. I mean, this past winter, they both ended up having the flu. I mean, there's just, and that's, we try not to get them out. You know, we try to limit how much they get out, I guess, in the sick months, you know, the winter months. But it just, there's a point where, you know, we just do our best, and we have to understand that they are going to get sick.
We've taught Carly how to cough in her arm. We've taught Carly how to stay away from people, you know, keep a certain distance from those who have colds. Also use sanitizer and always washing her hands. She's been very good about that, and I think with that in mind, she's also been able to teach her friends how to keep clean as well, so that way her whole surrounding is like a shield. I remember her doctor would always tell us about the flu shots, that it's important for us to get flu shots and for her grandparents and aunts and uncles to get flu shots. So it's kind of like building a wall to protect Carly.
It is difficult to avoid germs completely, but there are things that people with cystic fibrosis can do. The most important thing is to keep your hands clean because very few germs in the United States are spread through the air.
Also visiting your CF Care Center as indicated. Washing and disinfecting your nebulizer equipment. We never want you to use a dirty neb. It's important for patients with cystic fibrosis not to come in contact with others that are ill or that have a contagious illness.
They should avoid other people with cystic fibrosis, unless of course they have siblings, and then we have guidelines for that. They should wear masks when they're in the hospital, and again, clean those hands every time you go through a door. Your CF team also tends to wear gowns and gloves so that we don't share germs from other patients with you.
It's really important for CF people to stay away from smoking or secondhand smoking or other airway irritants that you may come across. And the reason for that is because it can create a trigger for worsening cough or mucus production. It might make your airway a little bit tighter and difficult to breathe. So trying to avoid those types of things is going to be important to maintain good CF health.
Secondhand smoke and cigarette smoking are not good for anyone's lungs. So if you have a chronic condition of the lungs, such as cystic fibrosis, it is going to worsen the amount of mucus that those lungs make and, of course, make the disease progress much faster.
It's important to stay active and to do exercise if you have cystic fibrosis. So there's a number of different exercises that can be done, and there's a range when it comes to how often. We recommend that you do stretching, whether that's through yoga or just a stretching program, cardiovascular training. So whether that's walking, jogging, riding a bike, making it fun, we want to help you do that. We want to help improve your bone health, so there's impact exercises that we encourage, and also some resistance training. So whether that's through TheraBands when you're in the hospital or using weights when you're at home or in the gym. And honestly, we want you to do it most days of the week. So 5 days a week for the cardiovascular and 2 to 3 days a week on the resistance training and weight training.
Younger people with CF should also be active. They need to do a lot of bouncing, running. I like to work a lot with younger patients on the therapy ball. It's great for core strength, but also the bouncing can help mobilize secretions in their lungs. Anything the kids like, sports, swimming, running, riding bikes. The important thing is to stay active. No one exercise is going to be perfect for everybody, so it needs to be individual and something that person will love.
I just dance a lot throughout the day. But I have also done soccer, gymnastics, tumbling, and I've done a lot of stuff to keep me active, and it's really nice.
I like to go hiking a lot. I live so close to the mountains, so it's like a 5-minute walk. After that, it's about an hour walk, an hour hike.
For CF, exercise is very important, and so I always grew up doing ballet and gymnastics, so I am exercising several hours a day, dancing and singing, and I think that's pretty good airway clearance too.
To keep your child as healthy as possible, it's important to love them, hold them, take them to an accredited care center every 3 months or more often if indicated. It's important to have them take their medications, do their treatments, make sure you wash and disinfect their nebulizer equipment, have good nutritional habits, exercise, and most important, partner with your CF care team. They're there to help you keep your child as healthy as possible.
But the other thing I think that's important, maybe more important for a patient with CF to stay healthy, is you need to stay positive. You need to be encouraged by the wealth of information and new treatments that are coming out and the effect that that's having on achieving better quality of life and longer lives. And that positive, we know that positive nature is very important to staying healthy, both emotionally and physically. And I think that's probably the most important thing you can do to keep yourself healthy.
To learn more about this topic and how the Cystic Fibrosis Foundation can help you, visit cff.org or call 1-800-FIGHT-CF.